Well, it was interesting. It was one of my last rotations in medical school, and I wasn't quite sure what I was going to do. Went through surgery, and I thought that was okay, and I went through medicine, pediatrics. Nothing was speaking to me at that time, and psychiatry wasn't even on the radar for me. And it was one of the last rotations, and it was one of the easiest at our school. And so when I got my first patient, it was a psychotic patient, and came up to me and was floridly psychotic and was just delusional and paranoid and talking. I couldn't follow him, and it brought up this emotion in me. I said, what is this? What kind of sickness is this person suffering from? It wasn't cancer, it wasn't high blood pressure, but the person was sick. He was ill in the hospital. And then I didn't know what to do, but a few minutes later, he was taken by the psych aides and disappeared into the psych ward. And then a few hours later, I came back and visited him, and he was very calm and organized. And I said, wow, what just happened there? And that fascinated me because I couldn't understand or explain what was going on. And so that kind of mystery appealed to me because it wasn't so clear what was going on and what type of problem this person was having.